Dan Litwin and Teresa Gilmore. So we want to be sure to recognize them for their extra effort in times of stress like these. Everybody's familiar with Ellen Teeter, I hope, the executive director, and Natalia Morrison is our communications director. So this is the team that's really leading the charge with trying to keep everybody well informed and provide some instruction on how best to respond. The regulatory authority and statutory authority, I just want to make it clear for everybody to understand, starting on the left, the Florida State Legislature has two branches, the Senate and the House. Their responsibility is to create, change, or repeal statutes, chapters, and laws. That's the legal framework for how statutory language and laws get enacted. It's done through the legislature, and their three big roles are making new rules, changing existing rules, or repealing rules. And what we're dealing with right now is a rule change, because Florida acupuncturists are regulated under three particular statutes, or two statutes and one rule. That's 456 is the general provisions for health occupations. 457 is the Practice Act for Florida Acupuncture. And then the Florida Board of Acupuncture. I have Ellen.
Your slide didn't change.
Did it change now?
No.
Then it's frozen or something because I'm on the second. I'm on the. Let me escape and see if I
think if you go to the second screen there, it's would show it.
So let me see. Are you showing me the Florida Acupuncture title page again?
Yep, it's the title.
Okay. So is that the second page?
It's not moving.
Huh?
It's not moving.
I don't know so then I can stop sharing and just have a conversation with them because I know what my presentation says.
Okay. We will send that out to people afterwards.
Okay, guys, is that better, Ellen?
We can hear.
Okay,
we hear
just
you.
give me a thumbs up.
Yeah.
Guys, I'm sorry for the technical challenges. I don't have an explanation for it. Usually our meetings go without too much of a hitch, but I wanted to just jump back to what I was saying a second ago. Is the acupuncturists are regulated under general provisions for health occupations and our Practice Act. The bills that are being introduced, both the House bill and the Senate bill, they are seeking to make changes, not in 457, but in the general provisions, the statutes that apply to all licensed healthcare providers in the state. And the bills that are being introduced, they're looking to redefine a couple of terms. Those are, what is the definition of profession? What is the definition of advertisement? And what is the definition of deceptive or misleading terms or false representation? And the reason why we're discussing this with the profession is because it zeroes in specifically on the use of the word physician and the use of the word doctor in any title, any advertising, any communication, any promotion of your business. And, what the bills require is that if a provider uses those terms, that they cannot do it unless it's authorized in the Practice Act. In other words, unless the term physician or the term doctor appears in Chapter 457 as it applies to us. But that's not the case. In 457, neither the term physician or doctor appear there. And so the reason why we're seeking an amendment or a change to the bill is because it's within the power of the legislature to make exemptions and exceptions, where they're necessary or where it's fit. Not all the language in any one bill is going to cover every single circumstance. So they are able to write the bill, and then they're allowed to include certain exceptions. And we see in the existing version of these bills an exception for chiropractor, for podiatrist, for various authorizations for nursing and other professions, but there's no exemption for acupuncturists. And the reason why we're asking for it is because even though the term acupuncture physician does not appear in our Practice Act under 457, it's a long-standing term that's familiar to, patients, the state of Florida. It's been around for more than 2 decades, and it appears in that it was authorized by the Board of Acupuncture in 2006 to be included in a term that was acceptable for advertising. So even though we don't have an express right to using those terms in statute, certainly you can make the case that the initials AP and DOM are provided for in statute, and then the definitions for what those initials stand for are provided in rule. And like I say, the legislature has the power to, make these exemptions, and that's what we're asking for. So when I try to get everybody mindful that our talking points want to be really simple and straightforward. So when you contact your local district House of Representative, and you can find that person under the Florida House of Representatives landing page, it has a search engine for Find My Legislator. And simply put in your address, and that your local legislator's contact information will pop up and appear to you. And so you can contact them in their Tallahassee office, because that's where they are during session. You can contact them by telephone. Usually you'll get a staff person on the phone, or you can send an email. And FSOMA has provided several draft and template documents for licensees, for students, and for other supporters of the profession like our patients. And so we'll have a folder where we continue to provide some of that template language that allows people to just put in their name, put in their address, put their signature on it. And you want to send these communications to your local representative, because you are their constituent, you're their voter, your patients are their voters. They depend on your local support, and we depend on them to represent our interests. So it's a natural relationship between you and your local representative that doesn't necessarily apply to somebody halfway across the state. The exemption, the exception for that is that the leadership, so the president of the House, the pro tempore in the House, and the person who's sponsoring the bill, this is Dr. Ralph Mazzullo in the House, they can be contacted directly from anybody anywhere in the state, because they are responsible for both the leadership direction in the House as well as the sponsorship of this bill. But you don't need to contact every other single representative, because it's a big profession. We've got people all around the state. It's best that you contact your local state representative and communicate the concerns and talking points that we have for you. Basically, we have one ask. And of course, there's a dozen things that we could ask for. And there's a dozen reasons why we could ask for it. But it's simpler if we just tell them, look, House Bill 583 needs an amendment for acupuncturists. Full stop. That's really all we need to say. And if somebody says, why is that important? Then you might want to add, well, it's important because it's permitted professional titling for acupuncturists going back 2 decades. No acupuncturist has ever been disciplined for misusing or abusing their professional title. Our patients are well aware that we're not surgeons, we're not dentists, we're not anesthesiologists. They're coming to me in my private office for acupuncture care. And so the bill doesn't serve any particular public good by restricting how acupuncturists can use their professional titles. Okay, that's it. I mean, that's the most anybody would have to say. And, I gave you the simple talking point that we're looking for an amendment to include acupuncturists in House Bill 583, and we'll provide a written, version of the other 3 things that I said, just so everybody has it in front of them if they feel like they really need it. The fact of the matter is that couldn't be more pleased. And I know the association and the communications directors have been working really hard to move our messaging forward. And the profession has really stepped up in an amazing way. The students have done a tremendous job of using social media engagement to really drive this conversation, to spread it from student to student, practitioner to practitioner. And this is the kind of, effort that we need, not just for a couple of days. The House version of this bill is yet to be heard in committee. It is at the very beginning stages of being looked at, being considered, being discussed in the House. So we have weeks of opportunity to not only, to introduce our message, but to have that message evolve, and we can continue to give them more information, new information. And we don't have to, come up with 30 things to say in the first day. Just one or two simple things is all we need. Because next week, we're going to have new talking points for you. The following week, new talking points. So we can expand on this as we move forward without overwhelming the people on the other end of the phone or the people that are trying to manage this information in Tallahassee. This is only one bill of many, many, many bills that they have to deal with. And so we really need them to be, care and be concerned about our issue here. But the only way we're going to do that is if we're polite, we're pleasant, we're clear, we're articulate, we're concise. We know what we're saying, we know what we're asking for, and just keep it really simple. We have a professional lobbying team and attorneys that are available to us full-time in Tallahassee, and they have direct relationships with the staff and with the legislators themselves. So anytime anybody needs to have more information, they know where to go. They can, reach out to our lobbyists, or our lobbyists reach out to them and have a sit-down conversation over 10 or 15 minutes where we can share documentation, history, context, all of the things that are important that it's really hard to communicate even, in a telephone conversation or in a tightly scripted written letter. We don't want it to go on for 3 or 4 pages. Nobody's going to read that much. All we need them to understand is that, this rule may be valuable, the change might be necessary, but, creating damage, financial burden, and hardship on a profession that's never had any issue with being, mistaken for surgeons and anesthesiologists and cardiologists. This seems like it's an unfair, unintended consequence of their bill. And this is exactly why amendments are used, so that they can create little carve-out language to protect, professions like ours from becoming a casualty of a broader movement to, restrict how some of these terms are being used. I think our background, our training, our education, and the history of our licensure in Florida demonstrates that we can be responsible providers and that we're not contributing to some grand misunderstanding or abuse of the word physician or doctor. So with that, I thank everybody for their attention, and I really commend everybody's efforts for getting involved and making early contact, what will hopefully be frequent contact with their local legislators. And I think in conclusion, I just want to say one important thing, and I want to thank and I want to recognize Dr. Richard Lau, who provided an interesting and thorough, well thought out podcast on the question of Senate Bill 230 as well as House Bill 583. And I think he led with something that I want to echo. The changes that are being discussed in statute have no impact directly on our scope of practice. It's not about restricting what we can do or what we can do with patients. It's really about titling and what we call ourselves. And as important as that is, I think that understanding that our commitment to patient care, our ability and level of patient care is unchanged. If this bill goes into effect in some way, it's not going to change what licensed acupuncturists are able to do in the state of Florida. I think it has some ripple effects that, make it, that may damage our reputation or make it more difficult for us to do interdisciplinary work with other professions. It has indirect costs to us, as well as some direct costs, but it doesn't limit or change our scope of practice. And a lot of times when we get the profession involved or students involved in legislative action, it usually revolves around some restriction of the scope of practice, but that's not what's going on here. It's only a restriction of the use of titling for advertising and promotion. And so, although we want to defend every inch of ground that we have as a profession, that's the role of the professional association. It's why we depend on licensees and students and patients to get involved in these types of initiatives. But in this case, it's all about titling and not necessarily about quality of care or extent of care or scope of practice for care. And I just want to remind everybody of that in terms of what's at stake, okay? I'm going to conclude my comments and presentation and welcome everybody to share a question via the chat or QA. And again, my audio on my end is not working, so I'm going to depend on a little assistance if you want the question to be answered by me. We also have Corinne Mixon, our state lobbyist, on the line with us. So if there's anything that you'd like to direct to Corinne, she's available for questions as well.
Corinne, would you like to say a couple words for us, please?
Yes, sorry about the, I was on mute there. Yes, thank you, Madam President. You know, we're right on the policy here. We are absolutely right on the policy. We have some technicalities in statute that are holding us back. And those should be ignored and overlooked. And we have a strong position here, and everybody just needs to hear from you all, their constituents, about this is a costly and harmful, you know, type
Okay,
of
I took a question from Ellen, and if give me the thumbs up. You ready for me to proceed with an answer? Oh, don't.
Are you able to hear me?
Is that a thumbs up?
No, Corinne is speaking. So Corinne, please continue. Unfortunately, David cannot hear us.
Oh, that's okay. That's okay. So I know I'm exceptionally proud of this webinar. Optometry and acupuncture are probably the two most upset about this at this point. But a lot of the professions do not like it. And from what I'm hearing, next to the death penalty bill and the gun carry bill, as far as the Florida House goes, the majority of the calls that are coming in next to those two are really regarding this bill. So it's very meaningful to reach out. Please don't feel like your voice won't be heard, and we need to just show up en masse on the calls and emails expressing, you know, that this is harmful to the profession.
Thank you, Corinne, so much. I will share, guys, the screen with you for a second. Here is the FSOMA website, just in case if you have not received an email. Here is all of the information for you. Then you scroll down and you will see a Florida breaking news right in the middle of your screen. Here are all of the information provided for you with the links, how to find your representatives. Here are talking points. You can just click on the link and it will provide for you some of the templates. So all of the information is here. It's a little late for the senators, but just in case, you're welcome to contact them as well. But major effort right now shall be pointed to our House representatives. Here are all of the clicks, and please contact your representative found here with the talking points outlined here, which your link will take you into. Thank you so much. I will stop sharing.
I'm gonna give David a thumbs up.
I apologize, everybody. You know what? I logged back in, and of course, now the audio works just fine.
Okay.
Okay, after my presentation and Q&A and the whole nine. So thanks for everybody's patience with that nonsense. Was there a question that I missed? I just logged in.
Well, let me read a few for you, David. There's one about how often should we be reaching out?
Okay, so I would suggest if you've already reached out to your local legislator, okay, then it's probably not necessary to do so again for another week. I'd give them, 5 to 7 days in between calls. And what I'd like to be able to do is provide a trickle of new talking points and a trickle of additional details that you can then introduce. You say, hi, thanks. This is David Bibby calling again. We spoke last week about House Bill 583, and we, voiced some concerns and objections about the present version of that bill. Based on some new information, I'd like to share a couple of things with you and be brief. And just ask them, have you heard anything about it? Are you on a committee that's going to hear this bill? Do you have an opinion one way or the other on how you're going to vote for the bill? Is there any additional information I can give you to help you better understand our concerns about this? Something like this, you can create a little bit of dialogue that way. They may say, sure, send me what you've got, or I'll plan a call with the representative. You just don't know what direction that will take. But to call them more frequently than once a week, unless you were in some close contact over a discussion about language or introducing an amendment, it's probably too much. Like I said, this is probably one of 60 bills that may be on their desk that they're considering, and they're hearing from constituents on all those issues all the time. So I think touching base with them once a week is enough. But it's also helpful if we have a new talking point. You don't want to hit you want to be able to expand on what you've already said so that the call appears meaningful.
David, which is a projected voting date on that bill?
I don't know that the committees of concern have been assigned for the House bill yet. It's been read once, but it hasn't been assigned. I shouldn't say that. You know what? I think it's going to Health Policy Subcommittee sometime in the next week, and that'll be their first hearing of the bill and in the House. And so, anybody that's in touch with their local representative, we can send you the contact information for the leadership, the chair and the vice chair for that committee. I think everybody wants to give a call into those offices, as well as the sponsor, Dr. Mazzullo's office, should really be hearing from everybody, whether it's a student, a licensee, or a patient or another interested party. They should be contacting the sponsor's office directly, because ultimately, in the process of creating a bill, when someone sponsors legislation, it's usually proper etiquette, among colleagues, is that nobody's going to just stick new language into that bill without getting some approval from the sponsor. And it keeps everybody, from stepping all over each other's toes. The only time that language is usually injected directly into a bill, and it goes through the sponsor, but it's going to come from the leadership. Okay, and so the leadership, like the president of the Senate or the pro tempe, or the chair of a committee that's going to hear the bill, they may have a conversation and say, look, we know this bill is coming before the committee, but I've had input already from members on the committee as well as from the public that they want to see an amendment. Would you be open to including an amendment language for acupuncturists? That's the way those things kind of happen. And so if we can get, in and around and on top of and all around that, create a little bit of a echo chamber around our concern, that's the best way to affect the, introducing new language or creating some other type of exemption. And the reason why I keep saying that acupuncturists need to be included in the bill is that there's a number of different ways that legislatures could go about doing that. And so it's hard to be, overly prescriptive in that way by telling them exactly what we want them to do, because they might say, we can't do that, but we have an alternative way to fix your problem. And so, we want to sort of let them know that there's an issue, and then, say we have an idea on how it can be fixed, but not overly prescribe that, because they may have their own version of how to fix it. And we don't want to, interfere with their creativity. Okay.
David, there are some Q&As. I think we've answered some of them about how did this occur. It's part of a bill that's much broader than us. It's not
right. Okay,
that's nobody trying to eliminate us.
No, I think that's, Ellen, that's an excellent point. And I think I do. Let me take a second on this. Understand that this change is not coming in 457. It's not directed at acupuncturists, in our own chapter. This is about a change to the overall statute that regulates all healthcare professions in Florida. And so, some people are affected, directly, some people are not affected, and some people like us are just kind of caught up in it. Nobody was sort of, trying to stick it to the acupuncturists. But in the meantime, we've done a very good job of highlighting the concern that harm is going to be done if this bill passes in its existing version. Harm is going to be done to acupuncturists, to the acupuncture profession, that we really feel as though our historical use of these titles deserves an amendment, and and that's the best way to remedy it. But this originated as a fight between other professions, and other professions, overlapping and using professional titles of physician and doctor. And so the whip is getting sort of cracked on this question, and now, anybody who doesn't have an express authority to use the word physician or doctor in their statute is getting rolled up as a casualty. But that's again why I say, exemptions and amendments exist for problems like these. And so we're just trying to appeal to their better angels to say, there's no reason to, cause harm and trample on our profession when, a couple of lines of legislative language can sidestep the whole issue for us.
I do want to, there's a question about prescribing medical marijuana, and we are not able to prescribe medical marijuana. So it's not taking that away. We are not in the legislature's authority to do that.
Right. The state legislature and the language around medical marijuana prescribing is really clear in terms of, who's authorized to do that. And, because of the way medical marijuana is regulated, here in the state, it has a very tight prescribing authority, and it's not extended to acupuncturists.
It's only MDs and DOs, actually, no other provider type.
Right. And thank you, Corinne. So, it's even for people who do prescribing every day and have prescribing authority under supervision, they still are sort of locked out of doing that for the time being. It's still relatively new law in Florida. In a decade or so, it may be regulated in a completely different way.
Can you see the Q&A, or do you want me to read them, David?
I can see the Q&A.
I have one that I can step up on if you guys, while you're reading them.
Thank you.
Sure.
This is Corinne. Regarding other provider groups that are upset by this, and I will say, nobody likes this bill that is of any provider group that's not an MD or DO, because it just feels stifling in some ways. But I think the groups that are most upset by it are optometry, there are doctor of optometry schools, obviously, acupuncture, and those are really the two groups that I in my mind should be sort of the most floored by this. But the nurse anesthesiologists, as they now call themselves, are definitely at the top of the list, and that's really what kind of catalyzed this legislation. There in rule, the nursing board came in and said we can call ourselves nurse anesthesiologists versus nurse anesthetists. I'm terrible, I butcher that every time. So those are the groups that really have kind of an axe to grind with this. But there's a sensitivity on the part of the Florida House, which is a very free market, medical freedom community, that there are multiple provider groups that are upset by this, and certainly our message is as good as any.
Thank you, Corinne.
I'm going to answer one real quick, David. I don't know of an AP that was arrested for calling themselves doctor. I do know there was an acupuncture disciplined, one for injecting Botox, but he also did not make it clear on his website that he was not a medical doctor. He wasn't arrested, but he was disciplined by the Board of Acupuncture for those two things.
And in that case, I think it was a combination of things. It was the manufacturer for the substance that he was injecting also had him listed as a provider on their website, and that kind of got drawn into the evidence for the disciplinary case. And on the third-party website, they had used doctor in front of his name without any type of a specialty. And I think, it's a little bit of, a message to all of us that, we have to sort of, look to the statute, see what's permitted, look to the rule to see what's permitted, and also understand, how we use or properly identify ourselves based on our academic titles, and that we're doing that in a complete and accurate way that satisfies, full disclosure about your area of specialty. And so without pointing too many fingers, I mean, there's a lot of other types of non-academic programs that are certificate programs out there that are pumping out, 8.5 by 11, sheets of paper that say that you're suddenly a doctor of some new medicine, doctor of homeopathy, or a doctor of functional medicine, and sort of including these things that don't traditionally have an academic title, or a holistic doctor that doesn't really have, any other, particular academic PhD program or a doctoral program that's recognized by the Department of Education tied to it. I'm not saying that there's none of those exist. I'm just saying a lot of them mischaracterize, the education that they provide and the certificates that they provide and the titles and occupations that are associated with that course of study. And so there's inside baseball, and I think there's been a struggle with the autonomy and emergence in nursing that's probably causing a little bit of this consternation with physicians and medical doctors, as well as that's on one end of the spectrum. The other end of the spectrum are people who are really unlicensed to provide, under any healthcare regulation, who have been awarded certificates for completion in some things that have a physician or doctor associated with it, and they don't necessarily know any better, or maybe they do know better, but they're moving forward with opening businesses and creating websites and advertising and such. And it's enough to catch the attention of the 458 and 459 licensees, the medical doctors and osteopaths, and they want to circle the wagons on how some of these terms are used. I think as a profession that's been licensed in the state for 3 decades or more, we have an excellent track record in how we use our professional titles that have not created problems with other professions. This is just a situation where, because we don't have express language, that we need some support from the legislature to create that exemption for us. And if we don't get it, if it goes through and succeeds this year or next year or the year after, it may require us doing some modernization to the statutory language for 457 to provide those definitions, and to make the case to the sponsor of that legislation and their colleagues that we're the right profession with the right training and the right history to have continued access and use of those titles. But, if it doesn't go through, then we're going to be, defined the way you see it in statute as a licensed acupuncturist. That's what appears on your license from the Department of Health. And the House bill provides for people that are non-physicians, which, if you look at the definition of physician under 456, it provides for a list of providers that does not include acupuncturists, like MDs, DOs, chiros, podiatrists, dentists, and 1 or 2 others are listed as physicians. And so anybody that's not on that list is considered a non-physician. And so if you're a non-physician with an academic title of doctor, then there's a specific way that they want you to use your initials with a D period in your specialty. And if you associate the word doctor with your advertising or title, then it includes your area of specialty. So that might read Doctor of Acupuncture and Oriental Medicine, or whatever, the Department of Education agrees that can be awarded on your diploma. For example, here in Florida, it's typically DAOM, but if you were coming in from out of state, there's several other titles that the Department of Education allows, colleges that put forth a doctoral program, they have other descriptors for that. And so as long as it's, that's the idea, is that you want to make sure that, your titling is paired with what's otherwise available from your degree. And if it's not, if you don't have a doctoral, as the statute reads now, we're all acupuncturists are defined. And the license that is provided to us says licensed acupuncturist on it. So we'd lose AP, or not AP, but acupuncture physician. I think that would be a tragedy and a shame. It's been a, part of our profession, not only here in Florida, but around the country for decades. But if it does happen, then, those that did not have a doctoral degree awarded would be LACs.
I want to make a comment. There's a question about a lot of students are hearing back from reps that they have no idea what we're talking about.
That's because the bill
Okay.
is fresh in the House.
Yeah, it's new in the House. The other thing I know from experience is, I don't know how, we talked at the beginning, FSOMA has around 20% of the acupuncturists are members. The chiropractors have something like 90%. They have like 4 lobbyists. They have an office staff of 7, so, we have a lobbyist. We're hiring another one to help to assist with that. We have 2 almost full-time office staff people who are acupuncturists and know the profession, but we need people to join FSOMA, to be members, to participate, but we also need you to call your legislators.
Right.
Really, every summer you should be visiting your legislators and getting to know them and talk to them. I was down at AMC one year, and they had a senator talking to the students, and he didn't know anything about acupuncture. Nobody had gone to visit him. He wasn't on a healthcare committee. We use our resources to target the big committees, but we need our members to let their legislators know how the legislator can help you as their constituent. So,
Right. I mean, it's instances like these when we really have, something that has to be acted on urgently, that I'm always grateful for the strong response that we get from both members and non-members. But sometimes it's hard. We've had years of, we haven't had changes to our statute in, 25 years, mostly because the statute, serves to protect the public adequately, and it serves the profession adequately. It could benefit from some modernization after these years, just because terminology changes, the scope of our education and training changes. And so you want to be able to sort of, make those changes a little at a time rather than a lot all at once. But either way, I'm really glad to have everybody's support. I know Ellen is too.
I do too. But, we did try, probably 12 years ago, we were going to introduce some legislation, and there were some acupuncturists very frightened that opening up the Practice Act would cause danger and harm.
Yeah.
And that's possible, but, if we can't be unified in whatever we put forth, it goes away. That's what happened.
Yeah. And in this instance, I think that, we'll have some more discussion with the members and the profession at large about, the areas that we think really would benefit from a little bit more, updating and specificity. It's healthy for the profession to be able to do that. If we're going to continue to be able to expand our footprint in healthcare a little bit, or even just, anchor our position in healthcare, so that when things like this come up, we're not sliding backwards.
Reiterating on what David said, and some of the questions in Q&A session. Current bill is primarily about our titles. It does not affect our what we can practice. Though I have seen some questions how it affects our ability to order labs and so forth. And that is actually also somewhat a gray area which requires more definition. And that is one of the parts which we, led by David's legislative committee, are working on now to be much more definitive. What are prescriptive rights, what exactly can be injected, and all of that. It's why it is time for more well-defined statutes for our profession. And believe us, we're working on that diligently.
I think in balance and in fairness, just so everybody understands, when the Practice Act dates back to the 80s, but it went through a bit of a retread in 1997, and an update in 1998 was really the last language. And a lot of times when legislative language is written, there's a value to keeping things relatively vague and undefined. You know, you just, the more specific you get with certain types of language, you know, it can create problems that really, you know, narrow your lane. And so the language that's written in to be general and all encompassing, you got to remember 25, 30 years ago where the profession was compared to where it is now. I mean, just look at the changes and advances and discussion around, you know, insurance reimbursement, recognition with interdisciplinary providers, and our role in healthcare is completely different than it was in 1998. And so the same vague and general terminology that was used, that was helpful to get the Practice Act established, because if you came blazing with lots of specific, you know, definitions and permissions to do lots of medical intervention, you know, they would have had tremendous resistance, and it probably wouldn't have gotten done. So they were basically trying to provide a way for the profession to get a foothold in Florida, so that your education and training would be consistent, your ability to be recognized as a healthcare provider under 457 would be consistent. All of those things were very effective. It's just that as, you know, time goes on and changes happen externally, you know, in healthcare, as well as internally with the profession, some of the things that were vague and non-specific in the past, they really need to be better defined, because that's being demanded of us. It's being demanded of the profession. And so you're sort of getting a sideways glance from other medical disciplines that think, you know, well, why don't they have that clarified in statute? Why doesn't that language exist? So it's our time and our turn to go ahead and do that.
David, and please correct me if I don't understand correctly or if I'm wrong. There also has been question on how change in title will affect our insurance billing. To my understanding, it does not, since we are billing for services provided, which
Correct.
are not based on specifically being to acupuncture physicians.
I would agree that there's no change there. It may, depending, you know, if I would review your provider contract and to the extent that if you're signing those documents as acupuncture physician, or it references you in that way, you know, this is, of course, is after the bill passes and gets enacted, and we're a little ways from that. But if this was to completely unfold the way that with no changes, then you might, just for accuracy's sake, even though, you know, contracts is not necessarily a form of advertising, but it may be considered somehow false or misleading if it's included in your credentialing your credentialing contracts, or in your QA, CAQH, or anything that's being used as a pass-through for credentialing. You want to make sure that you're using your proper titling at that point. It includes acupuncture physician, and that gets stricken down from us. You want to remove it and use the initials based on your training, doctoral or non-doctoral, so that it reflects it accurately. But in terms of billing and services, no, because that's why, you know, you look at some of the challenges that we have in general with insurance. You're getting paid for acupuncture services, your licenses to provide.
Now, we are licensed acupuncturists in our statute. So LAC is an acronym. AP is what we have at the front of our license number. I don't think that'll change. I was told by somebody in the state, AP just means acupuncture.
Yep.
So, yeah.
And that's the thing, you know, we've had these conversations, and there's a lot of, you know, things that we take for granted, saying acupuncture is, AP is an acupuncture physician. Well, for somebody who's uninformed, they might look at that and say, well, maybe it stands for acupuncture provider or acupuncture practitioner or something, you know, and that we've taken liberty with that in some way and called it and converted it into a physician. You know, there's arguments to be made that we really depend on looking to the way that the board clarified that in their advertising provisions under 64B1 9.007 for advertising, is that it creates some permissions for us around use of that language. But from a statutory authority versus regulatory authority, this is why I wanted to make that point to you guys earlier, is the statute is preemptive in that way, in that the board is only allowed to interpret the rules, and if the rule, and they can only interpret the rules in 457. And so if
No,
the rule,
the laws of 457.
I apologize, the laws in 457 and the proposed bills are going to change the statutory language, the laws in 456, and everything falls like a house of cards underneath that. So this is why it's, we make our best effort to resist and push back and make the case that these longstanding, common uses of this language has brought no harm to anybody along the way, and yet changing it will be harmful to the profession.
And we had spent a lot of time trying to modify in the Senate. And when we saw that wasn't going to happen, that's when we went public. So,
right. Well, this is the thing. We've been meeting with the Senator Harrell and the leadership team in the Senate to make the case for an amendment. But, they've got Senate Bill 230 on a lightning track. It moved through committee faster than anything you typically see. And that's because it's the leadership and, the chairperson of the Health Policy Committee that is driving that language in the Senate. And, they are the conductors, and there's nobody stopping that train. And so they went through 1, 2, 3 committees with no vote, no nay. And despite lots of conversation with the leadership, we just had no ability to persuade them that acupuncturists needed inclusion there. And so, they make the rest of our decision making very easy. We know that if we're going to make progress, then we need to turn our attentions to the House. Okay, if I'm happy to take more questions, and I'm available through email. You can contact the association or me directly at david@fsoma.org if you have something that you want to share. I'm happy to answer questions going forward. And I know everybody wants more templates, more talking points. We're going to continue just trickling that information out to you guys so that everybody has something in a timely way that they can share with their local legislator.
There's still some questions coming in about lab imaging labs.
No. Same thing. It's, you're able to, again, this is another area of diagnostic techniques that are permitted under 64B1. This appears in the rule, not in statute, as far as I believe. But it doesn't hinge on physician and non-physician. If you are a licensed acupuncturist, you're able to use imaging. If Quest gives you permissions to order labs, a change in titling is not going to affect your scope of practice to do that. From where we're sitting right now, that's unless somewhere in the Department of Health wants to exercise more influence and restrict who has access to those things, ordering labs or using labs. Then we have to make the case that again, diagnostic tests in imaging are allowed to us under board rule. Do we need to create new language in 457 that includes something like ordering labs and imaging under the practice of acupuncture? Some of that language may need to be expanded again if they're going to really drag every single act that's permissible out into the statute. There's an unreasonableness to it, but what we're dealing with right now is unreasonable. In so much as that Florida already has laws that they can enforce for using false and misleading advertising, for using medical terms and terminology that are, for practicing medicine without a license. These things are already in statute, yet they're turning the screws a little bit to refine their definitions. So anyway, I say they're doing it for this. They may do it for imaging later, but I wouldn't worry about the question about your titling over about your ability to order and use labs. And so much as if you had a quest if you had LabCorp or Quest ask that, you might just make a copy of 64B1 and send that to them and see if it satisfies their inquiry. And if it doesn't, then let Ellen and the association know, and maybe we can work through our attorneys to have a discussion with LabCorp and Quest to see if it's something we can fix.
Would we file a lawsuit?
Hopefully not. I mean, a lot of times, when things are clarified, I think, Quest and LabCorp are both private businesses that, they're in the business to make money and provide services. And
I'm sorry, it was about if we lose the amendment, if we don't get an amendment and it passes, would we have a lawsuit as a recourse?
I think that I know I've had a discussion with somebody who's very familiar with some previous case law and some other precedents on this. The answer to the question is that the outcome of a lawsuit is never clearly understood. You don't know at the beginning. I think the facts of the lawsuit would be subject to either an administrative judge or a civil judge's interpretation of whether or not what the legislature has the power to redefine the terms profession, advertising, and deceptive and fraudulent, activities. And if they are allowed to redefine those, and they are, can they put restrictive language in there that in the way that they have? And I think that, I don't know that the state has done anything overtly illegal, but I'm not a lawyer either. And so if we were to move forward with a lawsuit, you'd have to prove that, the legislature acted illegally, exceeded its authority in some way, and that, their statutory authority, was exceeded, and that's not going to be an easy case to make. It never is. When the legislature, they're changing a law, it's in their ability to change the law, and you don't like the way that it's impacting you, doesn't necessarily mean that what they did was wrong. So I would say we would investigate it. I think it would be worth, sitting down with the attorneys to go through exactly what happened. And they're already looking at that, by the way, just FYI, we've had that conversation with them to determine, do we have standing to bring a case? Do we have, merit to bring a case? And does the fact that the board, provided a definition in rule 18 years ago, does that have any bearing on 456? And I would say that that's the part. They're not changing 457, they're changing 456. And the Board of Acupuncture can only interpret the rules in 457. And so if 456 is amended, we might not even have standing in that. I think, via the board's decision to grant us advertising permissions for acupuncture physician and doctor of Oriental medicine. It may not, but I think before we just turned our backs and abandoned on it, we'd have to decide, do we want to fund a lawsuit to get them to overturn that in some way? Or do we want to, spend that same money or roughly the similar amount of money on opening the statute to provide the definitions that then, readmit us into using some of those titles the way that we had previously done it, as well as use the opportunity to modernize the Practice Act in some other ways.
Yeah. I think Corinne was going to answer a question for somebody.
Thank you, Corinne.
Corinne?
Oh, well, I was actually, the lawsuit question, I'd seen that. I think David did a good job of responding to it. People have certainly prevailed in lawsuits relating to this. Hopefully we don't get to that point, or we can come back and immediately change the statute to reflect the titles. I think what's going to come through, if there is an agreement between the House and the Senate, would be still the use of Doctor of Oriental Medicine, and then still the use of the title AP, just not in actually saying acupuncture physician. And so the question is, do you go to the mat on a lawsuit there, or do you wait until the next legislative session and come back and clarify? And that will be likely a game time decision once we know a little more. And that's assuming that this bill passes, which of course our our objective is to keep that from happening or amend it significantly.
Now is not the time to talk to the governor, is it?
We actually just put in a request with Brenda Burdett, who's the assistant to Stephanie Kapelousas, who's the legislative affairs director for the governor. So yeah, I mean, I think that this is the time, but what we have to do is you have to let the lobbyists reach out to the governor's office first on something like this. If it starts moving to make a case here, and then if there's a denial of that request, or if we're not making progress in the form of an amendment through the governor's office, if they don't have concerns of their own based on the lack of free market involved in this discussion, then we would, of course, ask that the membership call the governor's office. We're not there yet, and I would caution anybody to doing that at this point. But certainly that could be the next email that is sent from the association in a week from now, after this first effort has failed or succeeded.
Thank you, Corinne, very much. For now, I would again encourage all of us, please open every single email which comes from FSOMA. Please check back into FSOMA website daily. We will be keeping you all informed, and we will be providing the updates as soon as they are come in. And please contact your representative and defend our title. All of the talking points are provided on the website and in the FSOMA emails and other forms of the communication. The quickest updates might be found on the social media. Natalia does a great job. So please be active. Please talk to your colleagues. Please make sure that you are joining FSOMA. And if you know any one of the APs who are not FSOMA member yet, we need your support as your voice, as the financial support. So please.
Yeah. I mean, I'm so grateful. Thank you, Galina, for your comments. But, I look down and I see 60 participants tonight, and I'm grateful for every single one of them. I think we're being recorded, so this will be available to people, and, when their schedule is right and they can listen to it. But for a profession that licenses more than 2,600 providers, you think there'd be more ears on a concern like this. And so we're really, really depending on those, social media boosting, email sharing, colleague calling, whatever is necessary to double, triple, quadruple, push the number of people engaged, into the hundreds, even though, more than half of the profession should be involved. And you can see we have a fraction of that. So the demand is extraordinary. And so somehow we all have to find ways to, create multipliers of our own activity to have the kind of effect that we're looking for. Because, if it's just a whimper and a cry, from off in the shadows, this is not going to get the attention it needs. And it just, all it means is that instead of having an easier way forward, we're going to get, kicked to the curb a little bit. And then we're going to have to round up tens of thousands, more than $100,000 over the next couple of years from a profession that, we struggle to get their attention in order to make those changes in statute. And if we're unable to do that, then even though there's no, encroachment on our scope of practice, it certainly has a diminutive effect, a cooling effect on our professional reputation. And that's definitely trending in the wrong direction for us. So again, I'm so grateful that everybody is taking time out of their schedule to follow and listen and participate in what we're trying to share. But, even if you're able to encourage one colleague and two patients, to get involved, suddenly we can go from 60 to 260 to 660 and really create a little bit of momentum. Okay.
Squeaky wheel gets greased first. Please
Exactly.
create a squeak.
Trust me, the people that we see that got those amendments in the first round of the Senate, they were up there grinding to get it done. You know what I mean? And nothing comes easy. If they could have done this with no amendments on the Senate that had done it. So, we have our work cut out in front of us, The fortunate thing is that the bill in the House is not necessarily backed by the leadership. And so it doesn't necessarily have the same tailwind that it did in the Senate, but we do need to be aggressive about making sure that everybody that we can is contacted to know that we're not happy with this.
Yeah, and the problem in the Senate was the Senate president sponsored it, so nobody was going to put an amendment in without him okaying it, or her rather
Yeah.
okaying it.
But, I mean, in fact, Senator Harrell did the sponsoring, but when you've got the wink and nod from the leadership, you know, everybody, you know, there's a silent message that goes out that nobody's gonna mess with this and they're gonna green light it. And that's, like I said, it was, as far as I'm concerned, we've looked at legislation or new bills being introduced. Nothing moved quite as quick as that. Okay. It's the opposite of a squeaky wheel. That's a greased wheel. It just was flying through the Senate. And that the means is they narrow the opportunities in the timeline for any changes, because once it gets through, it's done. And they're largely satisfied with it in its present version. So I won't delay. Unless there's any other questions, I'm gonna call it a night. And we've got lots of work to do, and I'm on to, you know, a related project. So
No, David, if I could just one quick empowerment
please.
for the group, you know, as a lobbyist in the building and seeing the responses on people's faces when we are talking about this, it's a very simple message that in the state of Florida, licensed acupuncturists have been using certain titles since nearly the inception of the Practice Act. This change could have an unintended and harmful request on our providers that are taking care of people every day, keeping them out of hospitals, keeping them away from opioids. And in doing so, you're also sectioning off and making a costly, business-wise, a costly mistake to not major hospital groups, although there could be an impact there, but really what we're talking about is local business owners who, in a lot of cases, don't even take insurance and are taking care of people every day. And those factors are much more expensive for a provider group like us than many others. And as constituents, I think if you can get that message across in the Florida House, it is extremely powerful and very meaningful. So be emboldened and get out there and do this, because I can tell you it's going to take that kind of firepower behind us to get this amended or killed.
You guys, everybody just heard it from the person who knows best. Okay, that's the skinny.
Okay.
Thank you all so much. Thank you, Corinne. Thank you, David. Thank you, Ellen. Thank you, Natalia. And thank you all who have attended. Please spread the word around.
Yeah, I mean, we have a plan and we have this in hand, but we really need you know, the full support of the profession, or as best we can, between students, schools, and providers to get it done. Thank you, everybody. Again, I'm grateful for everybody's time and attention. And if there's any questions, please share them with Ellen or myself, or, you know, Galena, anybody that you feel comfortable reaching out to, and we'll help you as best we can.
Okay, thank you so much, everybody, for attending. I'll be posting the recording on the website tomorrow morning, and
Thanks, everybody.
thank you
Thanks,
so
Ellen.
much.
Sorry
Okay.
about my technical start with you guys.
All right, thanks.